Welcome to the ICT&health Podcast with Lucien Engelen and Jessica Workham.
Welcome to the ICT&health Podcast, the podcast currently from the ICT&health World Conference 2026, where we talk about all things tech and healthcare. And I'm here now with Martin Dorazil. He is an EU official working on the EU digital health policy who just had a keynote. Martin, thank you so much for coming. And can you tell me a bit about what you do as a EU official?
Thank you very much for having me, and it's a real pleasure to be here. So, as you said, I work for the European Commission as the deputy head of a unit dealing with digital health policy in DG Santé, which is a director general responsible for health and food safety in the European Commission. And among our flagship initiatives, or the most important initiatives, I would mention the work on the European health data space, which is a very important one. But we are also developing policies related to artificial intelligence in health, for example, and in general, support the member states in implementing the digital health solutions in their healthcare systems.
Right. And in your keynote, you talk a lot about the EHDS, the European Health Data Space. Can you explain a bit what that kind of legislation is and what it brings us in healthcare?
Absolutely, with pleasure. So the European Health Data Space is structured or built around two main pillars, or has two main objectives. The first one is to empower the patients. I mean, the patients are at the center of this endeavor. So the European Health Data Space will enable our patients to have better access, better and easier access to their electronic health data, and also provide them with better control over their electronic health data. So they will be able to decide who has access to their data and what is happening with their data. If they do not wish, for example, certain health data in an electronic format to be shared with certain health professionals, they may decide upon that. At the same time, this first pillar, which we call sometimes a primary use of health data for the purposes of provision of healthcare, will greatly help the healthcare providers and health professionals, because currently we see that even though the data are being collected and produced in the clinical settings, they are not always interoperable, and both the patients and the healthcare professionals are struggling, for example, with transferring the data between the two hospitals within the same member state or within the same region, leaving aside if the patient needs to, for example, travel abroad. So this will enable the health professionals to have easier and timely access to the data they need to provide the healthcare to patients in the format that will be understandable and usable for them.
Right. So the primary use for the EHDS is improving the data access for direct patient care, right? So I'm an ICU physician, and you're absolutely right. Sometimes I get someone from a different hospital, but I also get patients from different countries. If they're transferred, they had, for example, an accident while skiing, then they get transferred from Austria, for example, to my hospital. So are you saying that the EHDS enables me to access the data then in Austria?
Absolutely. I mean, it does. It's another great benefit of the European Health Data Space. If you provide the data in a structured format, and we will have the European Electronic Health Record exchange format that will provide the same requirements all across Europe, then it facilitates, for example, the translation of the data and the information. So wherever you happen to be, the physician will be able to access the data in the language that they are able to understand.
Wow, that's absolutely amazing, because now we usually have just one clinical note, usually in a language that I don't speak. So I think that really opens up doors. But you also mentioned in your keynote that there is a secondary use of data in the EHDS. Can you elaborate what that brings to the table?
Sure. The primary use is really about individual patients, their individual data, and access to data only by the authorized healthcare professionals.
Right.
So I just want to be clear on that. the personal data safeguards are in place and the data cannot be accessed by anybody else than a health professional that is authorized by the patient to access their data. Now, moving to the secondary use of data, this is the second important pillar of the EHDS, and that's about reusing data, large data sets in the health sector for the purposes, for example, of health research, innovation, but also, for example, for health policymaking and for improving healthcare systems efficiency. The system will improve, first of all, the findability and or searchability of the data. Sometimes imagine a researcher and they are starting a research project, and the first question they would probably ask themselves is there any data set that is relevant to my research project that I could possibly use? And currently, it's very difficult for them to even identify the existence of the data sets.
Right.
What the EHDS will introduce is the so-called European Health Dataset Catalogue. So this will be a public catalog, including the metadata, so the descriptions of the data sets.
Right, what type of data it is, right?
Absolutely.
Yeah.
So in that way, for example, I took the example of the health researcher. They will be able to identify whether the data sets they need exist. The second question probably that the researcher or more generally the data user will ask themselves is, okay, I know the data exists. Can I use it?
Right.
Am I allowed to use it? And then they will approach the new agencies that will be set up in each member state, the health data access bodies. They will file an application, a health data access application, in which they will explain for what purposes they are seeking access to this data. They will describe the data set. And then if the purposes fall within the legitimate purposes that are set out in the EHDS regulation, the Health Data Access Body will grant or not the permit to access the data.
Right, so just to clarify, it is not that there is one big, huge data set of every patient out there and that it is a free-for-all for all researchers that they can access that. It's really that we make the data available and interoperable, and that researchers can ask for access for a specific purpose, right? For a specific, and that will be the purposes you mentioned that are allocated in the legislation.
Indeed, I'm really glad you mentioned that because it's really worth clarifying. We are not creating one gigantic EU-wide database where all the data are centralized in one place. The data itself will stay where it is.
Right.
The system will enable the data user to identify the data, to request the access to the specific data set. And if the access is granted, then the Health Data Access Body, the public authority, will get in touch with the data holder and will request them to prepare the data and make only the specific data set available to the data user and that's also very important, in a secured processing environment. So that will be a software solution that will make sure that all the privacy and data protection safeguards are being respected, and that, for example, no personal data or no personal data can be extracted from this secure processing environment.
So from a patient perspective, right, if you hear, well, now it's your data can get, you can share your data, or in fact, it is being shared, your medical data, with researchers. You have some requirements for that data, right? In the sense that it is anonymized where possible or pseudonymized where possible, right? It's not that researchers can just access your personal information. It is all de-identified. Am I correct?
Yes, that's correct. The default situation is that the data are anonymized as far as possible. There might be exceptions where the research, I'm taking the example of the research project, it might be also for other purposes, but if the research project cannot be simply completed based only on anonymized data, in that case, the data needs to be pseudonymized.
Right.
But in any event, there should be no identification of specific patients, and any attempt to re-identify the individuals is strictly prohibited, and will be also punished. I mean, there are sanctions mentioned in the regulations.
That's really good to know. Yeah. So for the people who don't know the difference, and I'm very much butchering it here, but the difference between anonymizing and pseudonymizing is that anonymizing makes sure that you can't re-identify someone, and that is very difficult to do. So sometimes you need to pseudonymize, where in theory you can reconstruct who that patient was, but again, that is also really difficult to do. But there's just different levels of security there. And what I'm hearing is that if only in the cases where you can't anonymize, you will do pseudonymization, but there are also rules to access of that data that you can't try and identify the patients.
Yeah.
Yeah.
Maybe slight detail just to complement.
Yeah.
I mean, it was correct what you said, but this is about accessing the data within the secure processing environment.
Exactly.
So the researcher can, run their analysis or their operations within the secure processing environment, possibly on the pseudonymized data.
Sure.
What they are taking out of the secure processing environment needs to be strictly non-personal data. So,
Right.
so only the aggregated results, for example, of their processing.
That's a really good clarification. That is even a more secure layer than, yeah. So tell me, because we've been talking about a use case, right? Making sure that a lot more health data is available for example, research. But why is that important? What type of future will that bring us in healthcare if we do have this type of access to health data?
Yeah, we expect several benefits for different actors in the field, in the health sector, and both from the primary and secondary use of data. So when I'm talking about the primary use of data, certainly this will improve efficiency of the healthcare systems. For example, avoid duplications
Right.
or replications of tests, examinations, and different other activities. It will reduce the time that the clinicians or healthcare workforce spend on administrative tasks, trying to search for the data or information they need,
Right.
and they will be able to spend more time with their patients.
Good.
For patients, obviously, they will have better control over their data, so they will be able to decide what is happening with their health data. And for example, it will be much easier for them if they are seeking a second opinion, or they are just seeking treatment from another healthcare provider, just to take their health data and transfer them to the other healthcare provider in a way that the other healthcare provider can use it. So more generally, this will provide efficiencies for the healthcare systems. Now, looking at the secondary use of data, there are even further advantages and expected benefits. This should improve and contribute to innovation in the healthcare sector. So, more rapid development of new treatments and diagnostic methods. And also, we are talking about various digital solutions. So, for example, now with the increasing introduction of AI solutions in healthcare systems, to develop an AI system in health, you need large amounts of high quality data.
Right.
And this is exactly where the European Health Data Space will come into play and will provide that to the developers.
So this legislation will bring the future closer together.
Yes.
Perfect.
That's the right way to put it.
Thank you so much for your time.
Thank you. Pleasure.